This is for people who haven't really gone into surgery, or if you have had a family member who have undergone a surgical procedure. What we do as sterile processing technicians is to actually reprocess reusable medical instruments, avoiding infection to patients by decontaminating medical instruments, assembling them by testing them, and putting them into this autoclave for sterilization. Our final product after sterilization is not given to the user department until it's stored properly. One main concern of sterile processing is infection, and that's our job, to break down the chain of infection from patient to patient or from instrument to patient. There's a group that's responsible for monitoring sterile processing technicians or monitoring organizations to make sure that infection doesn't happen all the time, and if it does happen, you are held liable for that. Center for Medicare and Medicaid is responsible for monitoring infectious diseases transferred to patient acquired at hospitals. So we call these infections or diseases acquired from hospitals as hospital-acquired infection. And under hospital-acquired infection will be a surgical site infection. So surgical site infection meaning any infection that happens on the surgical site of the patient. So they all fall under hospital-acquired infection because, for example, you can come in with a runny nose one day and then leave with MRSA infection from a bed that wasn't cleaned properly. So that responsibility gets transferred to sterile processing technicians. So we are responsible to actually go after these instruments, make sure they're properly cleaned or disinfected before they're used for patient care. With that in mind, we talk about how people go about not paying for their medical bills if they ever have hospital-acquired infection or surgical site infection. In 2008, the CMS came together with a proposal and a mandate saying that if you ever acquire any infection on your visit to the hospital that wasn't previously in your system, let's say you didn't have MRSA before you got into the hospital for treatment, once you get into the hospital for treatment and got some infection from the hospital that's hospital related, the hospital is to treat you for free because they're responsible for causing that infection. So for those who don't know this, if you have any family member who went into the hospital without any prior infection of something they didn't know and went for like a nosebleed or something and came out with MRSA or tuberculosis, number one, if the investigation has been done properly, that patient should be treated for free. Hospitals who are found to have infections or hospital-acquired infection on a higher percentage of patients who visit, federal government withdrawing Medicare and Medicaid patients from that facility or that center for treatment. So that's how hospitals who have the repeated infection of patients of a higher percentage, depending on what the CMS determines, they'll stop sending Medicare and Medicaid patients. That causes a short revenue for said facility.